Good afternoon. My name's Anthony Tole, and besides me, I have my wife. She is Mrs. Puti Tole. I'll talk about my age. October next month, I'll be 83 years old. I used to be a journalist in Zambia. That's where I come from. I retired some 26 years ago. I worked as a journalist, as I say, for a news agency of the country. Now, one day, till December last year, as I went to the bathroom, I saw some little blood on my fingers, and which was a mixture of urine and blood. I questioned that immediately. When I questioned it, why did I? Because I had pricked my finger. That very time, I'm diabetic. So I was checking my sugar levels, only to discover that there was this blood. So I questioned, I said, is it because I had pricked my finger, or is this blood coming from my urine? But I had to make a quick decision. The decision I took was to go to the hospital. I went to the hospital to get what I noticed checked. So when I got there, tests started. There was now at the Euro department, I was told a suspected enlarged prostate gland. When they checked, they said, yes, it's suspected, and we will refer you to cancer hospital, which is in Lusaka itself. And when I got there, they confirmed that my gland was enlarged, 1. 2, they confirmed also that the gland, not only was it enlarged, it was cancerous. So the story starts from there. Now, immediately that happened, I had to take a position. What next do I do? I've established it's cancerous. To what stage is this cancer? UTH, the cancer hospital, carried the tests. The tests were conducted. They told me, yes, it is cancerous, but would not tell you the details at this stage. But we would recommend, if you want, that you go for specialized treatment. I said, oh, I'm a lay person. Where do I go for specialized treatment? Which country? That was the starting point. My doctor did tell me I should go to India. He was very categorical on that. He said I should go to India, and he was confident that I was going to get the treatment I needed to have at that time. So we engaged that route. I did make appointments with a representative who I got to know along the way, a Dr. Rohan, a representative of Yashoda Hospital in Hyderabad. I met him in Lusaka, and we had a chat about me. He told me, he gave me a lot of strength that I needed to get that specialized treatment. When we concluded the preparations, a date was fixed. That's when we left Zambia, and then we came, and when we got here, I must say, I don't want to shy away from the truth. We were very well received to dissect the complete body, get to know what was wrong, and so on. And then later, that was 14th, we finished the blood tests, everything else to do with the tests, so that the doctors got to know what it is that they were tackling at the time. You don't go hunting without knowing what you're tackling. Then I was admitted on the 21st for an operation which was done following day. I was seen by a specialist. I hope I will not be embarrassing him. He is Dr. Suri Babu. I've known him now. I've seen him a few times. Quiet, very decisive. So he told me, based on the tests he had on with him that time, And then he said, right, we are going to carry out an operation. He was very clear from the word go. It was going to be an operation, what is called the robotic, specialized form of operation, to deal with the cancer of the prostate gland. 3-hour operation, that was done on the 22nd. And I got out of there 2 hours down the line post-operation. And then I was sent to the side ward and so on. And an hour later or something like that, I was able to talk to my wife, talk to my daughter who had accompanied us. There we were. I knew where I was and so on. All right. Where I stayed for 3 days. And then I got discharged to an apartment. Now, here is what is interesting. 22nd operation. 23rd, I was up and walking. I stood from my bed. I started strolling along the corridors. Of course, I was helped by the wonderful workers of the hospital, those that assist. They assisted just to be sure that I don't fall. They were there, they were handy to see that I was walking, I was in tune with my steps, and indeed I was. I had all my tubes with me around and so on. We went back, forth a little bit, came to sit. The following day, my walking continued. Third day, I was a strong person. Everything was removed, and there I was. I am there. Now, I saw Dr. Bob for a review 7 days post-operation. I saw him. He passed me as a fit person, ready to go home, ready to be discharged. Now, as I speak, the little robotic getting tubes into the stomach to handle it, that's modern. I'm a lay person. That's how they did it. It went out very well. Every time and all the time, you had someone coming to check how you are getting on. Is there something that is not being well done in as far as you are concerned? They are searching. You have to pass that. Say, all right, yes, I've observed this, I've observed that. Someone else will come. How is the food like? How is it? My wife was also eating from there. Are you happy with the food? She was being asked those questions. Yes. Oh, why don't you eat? You don't seem to eat a lot. You eat sparingly. Why? No, you can eat. And there we go. Are you comfortable? Yes, we are. If you have a little problem, you have a bell to ring. A nurse acts promptly to come and see you what it is that you want to be attended to. That is done throughout. And then there it is. Dr. Babu, I talked about, came that very evening, post-operation, 22 hours. How is it going on? I said, I'm all right. I'm perfect, Laura. Are you sure? Yes, he touched me. That was the same day. The following day, he was there. Are you getting on well? He says, yes. He says, I can see it. You are getting well. You can see it. You are getting a lot better. The third day of departure, moving to the apartment, he came and said, all right, you are definitely recovering well. And you'll see me on this date. Now it would be at his consultation room, which we did. So really, what I have noticed is the professionalism I have experienced in this hospital. Professionalism, kindness, friendliness, willing to work, and that is all round. That you see in the members of staff, different sections and departments. I'm saying all over the world, you have people coming here, and I've not come across one who I have heard complain about delivery of service, delivery of treatment, delivery of politeness, and so on. I think the members of staff across board of Yashoda Hospital, I don't want to shy away by saying I wish to pay our utmost gratitude for the job well done to us. Indeed, for the job they continue to do, and we wish them to continue to do that all the time. We have a saying in my language, I'll be 83 like I said. They say, an old man who has beard never tells lies. That is true. An old man who has beards never tells lies. What I have put across, and that's what it is. This is my experience. So we will be leaving to go back home. What have we done? We'll be going home away from home. We are most grateful. Thank you very much.